Hi, my name is Kendall Jones. I'm an advanced practitioner. I'm going to start by doing a head-to-toe assessment on you at ABC. Thank you for coming. I'm going to start by washing my hands, and I'm going to begin with the vitals. I'm going to start with the blood pressure. I'm going to place it over the brachial artery. I'm going to wrap it snugly. I'm going to make sure that your arm is at heart level. I'm going to listen, and now we're going to pump it up. Okay, very good. Blood pressure is 120/60. You have textbook blood pressure. I'm going to now take your respirations. I'm looking at your chest rise and fall. And you are having 16 respirations per minute. I'm going to check your pulse, your radial pulse. I'm counting for 15 seconds. Okay, 12 and multiply by 4. So you have 68 beats per minute, and I'm going to check your temperature. 98.7. Thank you very much. So now we're going to move on. I'm going to assess your hair. I'm going to start with your hair. You mind if I touch your hair? And then I'm going to move down your head and down your body, okay?
Okay.
So put some gloves on. I'm going to just say your hair is very nice. It's coarse. It's no scaliness, no dryness, no dandruff noted. Color is appropriate for age. Even hair distribution noted. Now I'm going to look at your face. Ear and eye is symmetrical. They're aligned. I'm going to look at your eyebrows. I'm going to just palpate for any tenderness, any edema, none noted. Hair is evenly distributed. Color is nice. Also, I'm going to palpate your sinuses since I'm here. Maximal sinus and frontal sinus. No edema, no tenderness noted. I'm going to palpate your lacrimal gland. Induct. No edema, no tenderness, no edema, no dryness noted, no excessive tearing. Very good. Now I'm going to just take a look at your mouth. The lips is intact, it's moist. Okay. Intact, it's moist. I want to open. I want to take a look at your buccal mucosa. Inside, your cheeks. They're moist, they're intact, no discoloration, no bleeding. I'm going to take a look at your gums and your teeth. No bleeding, teeth are aligned on top and bottom. Now I'm going to take a look at your tongue, checking for any whiteness on the tongue. Can you lift your tongue, please? Okay, it's hot, it's moist, no sores, no lesions. Now I'm just going to check your, thank you, I'm sorry, your gag reflex. I didn't mean to make you gag before I say it. Very good. So now I'm going to take a look at your nose. Oh no, I'm going to start with your eye, okay? Since I already have my ophthalmoscope tightened. Let's just take a look at my Snellen chart and cover one eye. I want you to read this, the smallest line that you can visualize.
DOITES.
Okay, and you're going to cover this next line and read that same line backwards.
SETIROD.
Okay, you're going to do a Romberg test. I want you to read the numbers, cover the eye.
289 539.
And do the same thing with the following eye.
935 982.
Alright, before I look into your eye, I'm going to do the visual acuity. So I'm going to check your visual fields now, okay? I'm going to start by telling me if you can see my wiggling fingers all day.
I can see it.
Okay, we're checking peripheral.
I can see it.
Okay.
I can see it.
Okay.
I can see it.
Peripheral vision is good. And now we're going to I want you to follow my finger, okay? I'm going to start and do an H. Note the nystagmus noted. No lid lag. Okay. And now I want you to take a look at the box over there. And now take a look here. Okay. So we did the far side, the near side. I was able to touch your bridge of your nose. And the nystagmus was located. Now what I'm going to do is actually look into your eyes, okay?
Okay.
Usually I take off the light for this exam, but for video purposes I won't. Okay, first I'm going to shine this light into your eye. I'm checking for constriction, pupil constriction. Very good. Very good, pupil constricted. So we can say pupils are equally round and reactive to light accommodation. Now I'm going to take a look inside and align your eye with mine, left to left. Alright. 1, this is the fundus exam, and I'm seeing a red reflex. I'm seeing retinal vessels. I'm seeing opacities and optic disc. I don't see any macular degeneration or macular stars. I'm just going to take a look at the other one as well. Okay, my findings are the same. Very good. Alright, next I'm going to take a look at your nose. I'm going to use my otoscope. First we're going to do the smelling test. I want you to close your eyes. I'm going to press down on one of the ala. I want you to tell me what you smell.
Coffee.
And next one.
Coffee.
And we're checking for patency as well. And we notice that your cranial nerve number 1 olfactory is also intact. Very good. I'm going to just palpate. Tell me if you have any tenderness.
No.
Okay, there's no edema or tenderness to the site. Excellent. I'm just going to take a look at the side of the nose now. I'm going to hold the nose up slightly. And look at the septal. No septal deviation. Mucosa is pink, intact. No excessive mucus, no discharge. Take a look. Alright. No lesions, no erythema noted. Alright, very good for your nose. I want to take a look into your ear now. Just clean this with my gloves. It is now clean. I'm going to take a look at your ears. Then we're going to do a hearing test. So I'll come around to this side. Can you see me? Thank you. Alright, so I'm going to pull up an article. Take a look. And I'm seeing your tympanic membrane. It's pearly gray in color. I don't see any discharge. I don't see any foreign object. No erythema or edema. Okay? I'm going around to the other side. Make sure my findings are the same. Very good. Findings are the same. Bilateral. We're going to do a hearing test now. And to do that, I'm going to get my 512 hertz tuning fork. And what I'm going to do is called the Weber test. I'm going to ring it, place it to the top. You're going to tell me if you can hear it in one or both of your ears, okay?
Okay. I heard them both.
Okay, now we're going to do the Rhine test, okay? I'm going to place it to the back of your ear, right on the process right there. And you're going to tell me if you hear it. And when you no longer, if you can't hear it, when you no longer hear it, I'll bring it to the front of your ear and you'll tell me if you still hear it, okay?
Okay.
So we do this bilaterally.
I don't hear it.
Okay.
I hear it.
Very good.
I don't hear it.
Okay.
I hear it.
Very good. You have excellent hearing. Okay. Moving forward, I'm going to assess your nodules. Your nodes, I should say, sorry. And I'm going to start with hair. Okay. So this is the pre-auricular, posterior auricular, occipital node, anterior node, posterior node, tonsillar node, submandible node, and the node here as well. Submandible, I can't remember, I'm sorry. And we have a node here at the chin, okay? And then we're gonna check for one node right here, subclavicular node, okay? Submandible, and I'll get it later. I'll come back to it. So all your nodes are all your nodes are non-tender, they're mobile, and discrete to touch, okay? Okay, so now we're gonna move on. So I'm gonna do your thoracic. Alright, so we're gonna start with the back. If you just turn to the side, please. Alright. We're gonna start by taking a look. It's symmetric. I'm gonna start by so there's no tenderness noted, okay? Then I'm going to check for expansion, diaphragm expansion. Okay, take a deep breath. And you can see the diaphragm moves about 3 to 5 centimeters. Now I'm going to begin by percussing. And checking for tympany. I'm going to come back and do the femoris test. Alright, it's tympanic throughout. I'm going to do the femoris test. I'm just going to palpate. And I want you to say 99.
99, 99, 99, 99.
Very good. Now I'm going to, it's called diaphragm excursion. So I'm just gonna palpate until I find the diaphragm. Okay, and take a deep breath. And now I want you to breathe out until I see dullness. And your diaphragm is about 8 to 10 centimeters. Okay. Now I want you gonna auscultate these same ears. Take a deep breath every time I place my stethoscope. Using a ladder technique. Alright, no adventitious breath sounds very good. So now I'm going to do the egophony test. I want you to say 99, okay? When I listen to the lower lobes.
99.
I apologize. I want you to say EE when I do, when I listen to lobes.
E.
Alright, very good. Now I want you to do the whisper pictorially test, and that's when you whisper 99. I shouldn't really hear you, or it should be very faint. Go ahead.
99.
You should be whispering 99. Alright, very good. You said it right because I didn't hear
Yes.
anything. Okay, so that means you're doing the test well. Excellent. So now I'm going to come to the front. And before we move forward, I just want to assess your thyroid. I'm just going to take a look at your throat. Okay. It's symmetrical, it's not swollen, no edema. I want you to I will move to the side, it's fine. I'm going to palpate your thyroid, and I'm going to feel for any nodules. What I want you to do is swallow. Okay, no nodules, no tenderness noted. No tenderness, right?
No.
Okay, very good. So now we're going to go back to thoracic. I want to listen to the front of your chest now. First, I'm going to do the femoris test. I'm going to press. I'm going to say 99, okay?
99.
Very good. Now I'm going to palpate. I'm going to percuss. Apologize. And I'm just checking for tympanic. I hope you can hear the percussion. That's my dog. Okay. Next, we're going to palpate percuss. Now we're going to do auscultations. Deep breath. Deep breath. Okay. Alright, very good. Next, no adventitious breath sounds noted. I just did auscultations, so I want to fill you out. Okay, so let's move on. We're going to do the thoracic, okay? I'm going to lean you back 30 degrees. Are you comfortable?
Yes.
Okay, I'm just going to take a visual for any jugular venous pulsations. Okay, and now we're going to palpate your, what's it called? Your carotid, okay? And that's to the midline, it's medial of the sternocleidomastoid, okay? Pulsations are brisk and strong, 2+ bilaterally, never at the same time. Now I'm going to check your pulsations here and your brachial. There's 2+ bilaterally, okay. Now I'm going to palpate with my pads of my fingers, the atrial area, pulmonic area, tricuspid area, and mitral area, okay? So the aortic area is the second intercostal space, right of the sternal border. That'll be right here. Pulmonic area is the second intercostal space, left of the intercostal border. That'll be right here. Tricuspid area is 4th and 5th intercostal space on the border of the sternum, which will be right here, to the left border of the sternum, and the mitral area is a lot more lateral, but still on the 4th and 5th intercostal space, and I'll be right here. Also in this area, I'll be able to feel PMI, which is pulse maximal impulse. I'll just measure it with my fingers for diameter, and it's about 2 centimeters, 2.5 centimeters in diameter. Also, as I palpate, I'm feeling for any lifts, heaves, or thrills, and none are noted. I'm going to just palpate these areas for any heaves or lifts. No heaves or lifts noted. Now I'm going to check for thrills by using the palm of my hand. Aortic, pulmonic, tricuspid, and mitral. No heaves, lifts. No thrills noted. That was my thrills test. Now I'm going to auscultate these areas. I'm using the diaphragm of my stethoscope first. Okay. And now I'm going to use the bell of my stethoscope. Okay. No S3. Okay. No S3 or S4 sounds noted. No pericardial friction noted. And now I'm listened. What I want to do now, I auscultated. I want to lay down and assess your abdomen. So I'm just going to start by inspecting the area. It's symmetrical. It's no discoloration. And no edema around the umbilicus or erythema. Okay. Next, I'm going to auscultate. Alright, so bowel sounds are present and active in all 4 quadrants. I'm going to percuss. Dullness to the right upper quadrant over the liver. Tympanic over the splenic fixture. Tympanic to the lower quadrants as well. And tympanic to the air bubble over the umbilicus. And I could observe aortic pulsations in the epigastric area. Now I'm going to palpate with one hand first. I'm just checking for any abdominal masses, any rebound tenderness, none noted. Okay, now I'm going to do a deeper palpation with 2 hands. Okay, no masses, no tenderness noted. Alright, so now we're going to do I'm going to assess your peripheral vascular system. I'm going to start, I already have the, what is this called? Brachial. So I'm going to go ahead and check your radial pulse bilaterally. It's strong. It's 2+. Then I'm going to go ahead and check your femoral pulses bilaterally. It's strong and 2+. Then we're going to go to popliteal. Okay. Dorsal. And posterior tibial. All are strong and 2+ bilaterally. At this time, I'm just going to measure carotid pulse with S1 and S2. Make sure that they're in sync. Well, S2. Make sure they're in sync. Okay. The right carotid is in sync. And the left carotid is in sync. And if you can sit up. Okay. I'm going to do the musculoskeletal assessment. I want to do that by starting with your TMJ. I'm going to place my hand right here. And TMJ, I want you to open and close. Alright. And now move your chin side to side. And then I want you to retract and protrude. Very good. No clicks or crepitus noted. And jaw moves smoothly and has full range of motion. Now I'm going to go to your shoulders. I'm going to palpate. Okay. No tenderness, no edema. I'm going to palpate bicep tendon. No tenderness, no edema. I'm going to palpate supraspinatus, inferior spinatus, tinea minor, and subclaviculis. And all non-tender, no edema noted. Next, we're going to do flexion and extension and full range of motion of the shoulders. To do that, we're going to start with flexion by raising your hands up above your head. Extension, bringing them down and back. Okay, we're going to do internal extension, internal rotation, which is up to the scapula. And then we're going to bring them back to the sides. Now wave them forward, put them up like this. Yeah, and this is called internal rotation. Very good. Now I want you to adduct, so you bring them to your midline, across the midline, and abduct, bring them down to your sides. You're going to do the same thing against resistance, so you can check muscle strength, but we know that you do have full range of motion. Up, 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 okay, and then in, and then out. Okay, very good. And you have strength 5 out of 5 to the shoulders. Now we're going to go to the elbow. I'm just going to brace the elbow. We want you to flex by bringing your palm to your shoulder. Extend, bringing it down, and then we're gonna, your palms currently facing up, we're gonna face it down, it's called pronation, and face it back up, supination. Exactly. Flex against resistance, extend against resistance, and you're gonna do the same here. Flex against resistance, extend against resistance, supination, no, pronation, and supination. Very good. And you have full range of motion bilaterally, and no deformities noted. Joint is stable. No joint instability, and strength is 5 out of 5 in the elbows. Now we're gonna move to the wrist. Excuse me. The wrist, the fingers, and the thumbs. All right, so I'm gonna assess all three. Feeling the wrist, the fingers, checking for any edema, any deformities, none noted. Any tenderness, any tenderness? No. Okay, very good. So I'm gonna start with range of motion to the wrist. We're gonna do one wrist at a time. So I want you to flex your fingers up, bring it up, yep, and extend it by bringing it down. Then you're gonna bring your thumb outward, that's adduction, nope, yep, and then bring your thumb midline, adduction, very good. Then you're gonna do the same here, quickly, flex, extend, adduct, inside, abduct to me, very good. Now do it against resistance, up, flex, extend, abduct, out, adduct, very good. So you have full range of motion to the wrist, and you have no joint instability, and also strength is 5 out of 5 in the wrist. Now we're gonna go to the fingers. To flex, we're gonna make a fist. To extend, we're gonna bring them out. Now we're gonna bring them together, adduction, and bring them away, abduction, very good. I'm gonna check for strength by pressing them together. Very good, I should be able to press them. And now I want you to grip my hand. We're checking hand grip, it's very strong. And then I want you to flex and extend your thumb. By touching your pinky, that's flexion, extensions, bring them away. And then we're gonna adduct, bring it to the palm, abduct, bring them out. Okay, you have full range of motion to both the fingers and to the thumb. Hand strength is 5 out of 5, okay? So now we're gonna move on. I wanna do full range of motion exercises to your neck since that you're still sitting up. Let's start by just air to shoulder, air to shoulder. You're gonna flex by looking up, no, extend by looking up, and flex by chin to chest. And then also you're gonna bring chin to elbow, and chin to elbow, okay? So we're gonna do the same thing. You do have full range of motion, but we're gonna check now for muscle strength again. Chin, yep, wrist down, flex, extend, okay, very good, and lean downwards, and lean downwards. So you have full range of motion to your cervical spine, and you have strength, 5 to 5, your cervical spine. I want you to stand up. No, actually lay down. I want to check for full range of motion in the hips. Alright, to do so, we're going to just have your knees to chest. Okay. And then we're going to come back up. Okay. Also, knees to chest. Okay, flexion. Very good. You're going to abduct. That means towards me. I'm going to brace the ankle. Now you're going to push. Yep, very good. And adduct across the midline. Yep. Okay, so we're going to do the same quickly. Up. Okay, towards me, cross midline, abduct, away, abduct, towards me, cross midline, adduct. Okay, and we did that all against resistance. So you do have strength, 5 to 5, and you do have full range of motion. Well, let's do one more test, turn to the side. And we're gonna have you do an extension. Okay, and it's against resistance, and again, extension, also against resistance. So now we know you have full range of motion to the hips, and strength is 5 out of 5. Now we're gonna go down to the knees, okay? I'm assessing the knees, looking at them, there's no edema, there's no tenderness. No discoloration, no deformities noted. So we're gonna bring the knees up. I want you to flex it by bringing it, no, excuse me. Flex it by bringing it down to the butt, yep, and extend it by bringing it up. Very good. I'm gonna do the same here. Flex it, bringing it to butt, extend it by bringing it up. Now I'm gonna hold here and we're gonna do the adduction, which is towards the midline. Yes, and abduction away from midline. Okay, now against resistance. And then out, okay, up and down, okay. And then I'm gonna do abduction towards me and adduction across the midline. Across midline. And adduction towards me. Now against resistance. Okay, flex, extend, and flex. Very good. So full range of motion to both knees and strength 5 out of 5 bilaterally also. Now we're gonna do the ankle, okay? To do the ankle joint, I'm gonna just brace right here. I'm gonna hold you right across your plantar and your dorsal area. So I want you to flex. It's called dorsal flexion, where you bring your toes towards you, and a plantar flexion, you bring the toes towards down the floor, correct? And then we're gonna inversion towards midline, eversion towards me. And we're gonna do that again. That's nice. So flexion, dorsal flexion, dorsal flexion, plantar flexion, down, inversion, eversion. And all of that is done against resistance. And just check for resistance. Very good. So range of motion, full range of motion bilaterally. And we have strength 5 out of 5 to both. I'm going to now toes. I want you to just squeeze your toes. That's flexion and extension up towards me. Okay, very good. Okay, and strength, that's 5 out of 5. All right, full range of motion was done. Don't remember if I popped it. Okay, let me set up. All right, so next we did full range of motion, did musculoskeletal. I want to check your spine. All right, so to do this, I'm going to assess the back first. I'm going to look at your thoracic spine, thoracic region. I'm palpating. There's no edema, no tenderness noted, no deformities. What I want you to do is flex by touching your toes. Okay, extend by leaning backwards slightly. There you go. And then we're going to touch the knees side to side. Very good. And now we're going to do it against resistance. Side to side. All right, full range of motion to thoracic spine with strength 5 out of 5. All right, so we did the musculoskeletal. Okay, and now we're going to do the cranial exam. Okay? We're going to do the cranial exam. So, would you want to sit or stand up for it?
Whichever.
Okay, you can stand up. First, we're going to do cranial. So, I want you to say, I apologize. I focus better. Alright, so for cranial, we have cranial nerves 1 through 12. We did 1 and 2 already. 1 being olfactory, 2 being visual, optic, which you see. So we're going to do cranial nerve number 3, 4, and 6. That's oculomotor, trigeminal, oculomotor, trochlear, and abducens. Okay?
Mm-hmm.
And by doing that, you're going to follow my finger. Alright? Did I do the H test with you already? Probably did. So what I'm going to do is up and out, up and in, down and out, down and in. I'm also going to do the 6 cardinal directions, okay?
Mm-hmm.
You have to follow my finger. And I'm checking for any nystagmus or lid lag. Do you have any headaches?
No.
Any dizziness?
No.
Okay. Now we do cranial nerve number 7, which is an upper and a lower. To check the upper, we're going to ask you to close your eyes, and I'm going to try to pull your eyelids open, okay? And for the lower, we're going to ask you to smile. Pretty smile, very good. Now we're going to do cranial nerve number 5, so sensation. I want you to close your eyes. You're going to tell me if you feel a sharp or dull sensation, okay?
Okay.
And we're going to check in the 3
Sharp.
areas
Sharp.
of the
Sharp.
face.
Dull. Dull. Dull.
Very good. Now we're going to check cranial nerve number 10 and 12. 10 being vagus, 12 being hypoglossal. So you're going to open your mouth, say ah.
Ah.
That's the vagus. And then you're going to move your tongue laterally. That's the hypoglossal. Okay. Also, we're gonna check cranial nerve number 9, and number 11. That's the accessory, and you're gonna push up against. Very good. So now we finish all the cranial nerves. Yeah. Oh, since I have this in my hand, we're gonna check the vibration test. So I'm just gonna place it on your fingers. You tell me if you feel the vibration.
Yes. Yes.
And we're gonna do it on the toes.
Yes. Yes.
Okay. Also, I want you to close your eyes and tell me. Open your palm and tell me what the object is.
A pen.
Okay, very good. And we do it with the other hand. One more object.
Tongue depressor.
That's really good. It sounds like you work in a medical field or something. Other people call it popsicle stick. So now I also want to check temperature. Okay? I'm going to check temperature. There's about 6 different places I could check it, but I'm going to just check it on your outer aspect of your forearm. Okay? Just for video purposes. Speed it up. So I need you to close your eyes and you're going to tell me if it's hot or if it's cool. Okay?
Okay.
Okay.
It's cool.
Okay. And we're going to.
It's cool.
I know. I don't really have anything warm at this time, but you were right with the sensations. They both were cool. What else we can do? I want you to do, since you're sitting, I want you to do coordination, just as one you're sitting. I want you to touch my finger to nose, with both hands. And now hold one finger up, like I am, and now finger to finger, and switch. Okay, very good. Now you're gonna stand up, and we're gonna focus on coordination. I want you to heel toe walk to me. Okay, very good. Now turn around. I want you to walk on your tippy toes. Very good. And now turn back to me, excuse me, and walk on the ball on your heels of the feet. Very good. Very good coordination, very stable gait. Now that you're up and standing, I want to check your balance. I want to check your drifter. And by doing that, you're going to close your eyes. You're gonna grab your shoulders alternately, yeah, just like that. And then I want to see if you drift side to side. Now drift noted. Very good. So now I want you to stretch your hands out like you're a zombie. And we check in for pronated drift. No drift noted. Very good. Okay. This concludes my test. I'm just gonna take the time to see if I've missed anything. I'm just gonna ask for a time check.
33 minutes.
33 minutes. I have 12 minutes to figure it out. Alright. So I'm gonna just look. You know what I should do? Oh, I did forget something. I'm gonna go ahead. Do my deep tendon reflexes. I knew I had too much time on my hands. If you don't mind sitting down, I apologize. Thank you for being so patient. Alright. So I'm gonna first start with the bicep tendon. I just want you to flex your bicep. Make a muscle. There you go, put it down. I can palpate the bicep tendon, and now I'm gonna percuss. Very good. Sometimes you gotta really rack it. I'm gonna do it bilateral flex. Okay, put it down. I'm gonna percuss. Very good. Now I'm gonna, since you're on this side, I'm gonna check your tricep. I'm gonna palpate. Alright. Okay, very good. Good reflex. I'm gonna do it bilaterally. Okay. Okay, very good. Now I'm gonna check your knees. Okay. And when I palpate, your knee foot should give a little kick if I do it correctly. Palpate for the tendon area. Okay. Okay. Okay, very good. I'm sorry. Did it hurt?
A little bit.
I apologize. Alright, now I'm going to do it on your Achilles. What I'm going to do is just put my hand on the bottom of your foot, brace it. I want you to, if I palpate, I know if I got the reflex if you begin to dorsiflex. Okay, your foot moves downward. So I'll hold it up gently, very, very barely, so you can see it. Okay, very good. We're gonna do it bilaterally. Okay, I apologize. Really banging you up out here. Alright, so that concludes my deep tendon reflex. So next, I'm gonna check and see. Oh, I forgot the bottom of the deep tendon reflex. We gotta use this nice sharp piece. I apologize. You stay seated. Don't want you to get up yet. What's gonna happen is I'm gonna check to see that you have negative Babinski sign. Okay. What that means is that if when I curl this under your foot, your toes will flex rather than fan out. Okay. If it does, that's not good. Okay. Okay. Very good. Very good. Nice. It's working. Just checking. Okay. Time check?
35 minutes.
Oh wow. Let's get through this. That means I missed the whole section. I have 10 more minutes. I'm just gonna palpate. So the muscle starts. Oh, I should palpate your liver and your kidney. If I haven't done that. Please lay down. Really don't recall if I did this test, so I'm just gonna do it back just in case. But then again, I could document it as well. But what I'm gonna do is put my hand, my left hand, under your 10th rib. I want you to take a deep breath as I palpate and breathe out. And I'm palpating for the liver. It should be sharp borders and smooth. Any tenderness?
No.
Okay. So I'm gonna come around to the other side. I'm gonna put my right hand under the angle, the CVA. And what I'm going to do is going to palpate. I'm checking for the splenic fracture, your spleen. I'm checking for your spleen. Okay. So what I want you to do is also take a deep breath. Okay. Breathe out. Okay. And it's hard to palpate, but that's okay. That's normal. And I'm going to move my hand down to the flank area, a little lower down. And I'm also going to ask you to breathe in and breathe out. And what I'm doing is out, palpating for the kidney anteriorly, just displace a little bit. But it's also pretty difficult to palpate, but there's no problem at all. Did my palpations, circles, did my readings. What's my time check now?
37 minutes.
37. Wow, I would have thought I did everything. So, just gonna assess my patient. Did the head, mouth, ears, nose. Eyebrows, ears, neck, through, thyroid, sternum, okay. Okay. What was my time check?
38.
I want you to sit up. Gonna assess the cranial nerve. I don't remember the number of the cranial nerve. But I'm gonna just hold on to your jaw. And I want you to clench. As if you're clenching, which I do. It is a cranial nerve. Okay. And I'm going to, is there anything I have to assess? Okay. And this is cranial nerve number 5. Cranial nerve, clench again, cranial nerve number 5, trigeminal, and sternocleidomastoid. And I want you to clench down. I should be able to feel you biting down. I apologize, it's trigeminal and sternocleidomastoid. That's right here. It's your trigeminal, and I need you to clench. And I should be able to feel you clench. Any pain and tenderness?
No.
Okay. Okay. And lastly, I'm going to Oh, what's my time check? I'm sorry.
40 minutes.
How much?
40.
Thank you. I have 5 more minutes, right? I could do this whole test. I'm gonna have you just lay back about 30 degrees. I'm just gonna measure positions. No, I'm just gonna do it now just in case I can't recall. I want you to just elevate your head. I'm looking at jugular vein pulsations. I'm gonna press my ruler against your sternum notch. I'm gonna just measure pulsations, and it's about 5. I know anything less than 7 centimeters is normal. Let's see. Okay. And that concludes my test.